So cholesterol, are you at risk? Pretty scary topic. High cholesterol, is it high? Doctors have created all sorts of guidelines with regards to cholesterol and connecting it to heart disease. So today we're going to be talking about high cholesterol. We're going to be talking about statin drugs. We're going to be talking about if cholesterol is actually creating a heart cardiovascular risk. And we're going to, of course, talk about solutions. So causes, would this be you? Are you walking a tightrope towards heart disease? We hope not. We're going to be talking about causes. The number one cause, if you remember anything, just remember this one thing. Eating starch and sugar causes heart disease. Eating starch and sugar, not eating bacon and eggs. That's exactly what I have every morning, bacon and eggs. So if you notice behind my head here, we have bananas, we have potatoes, we have pasta, we have cereals, all sorts of yummy things that we all love to eat. To the right side here, according to brain scans, sugar is as addictive as cocaine. We, as a nation, are addicted to starch and sugar. And guess what? It causes damage to cardiovascular tissue. And this is what I call the trifecta, the big deal. Raise your blood sugar, raise your insulin, and raise your cortisol. The three of those are destructive and corrosive to the inner skin lining of all your arteries within your cardiovascular system. So imagine little burns within your arteries. Then your body smartly sends out something called cholesterol to heal up that tissue. Those that drink alcohol, what organ system is a problem for them? Yes, you guessed it, the liver. Beat up your liver with alcohol, which literally is liquid sugar to your body, and guess what? Your cholesterol goes up. We do the same with starch and sugar as alcoholics do with alcohol to their livers, and therefore we raise our cholesterol. So maybe you can see as a nation that most all of us have too high of cholesterol because of our carbohydrate intake. So heart disease is actually created by starch and sugar intake, not eating eggs and bacon. How about cigarette smoke? Well, you'd say, well, cigarette smoke, what, causing cholesterol? I thought it causes lung cancer. It does. But if you look here to the right side, I highlighted two that are important. It causes heart disease. And when you cause heart disease, when you start damaging body tissues, organ systems, your body smartly sends out cholesterol to go heal those tissues. Beating up your liver with smoke, because your liver's a big filter, raises your cholesterol. But notice too also that cigarette smoke damages brain, it damages your eyes, your kidneys, just about everything. And today, most people have gotten the memo that smoking cigarettes is not a good thing. Autoimmune diseases. The most common today for ladies especially will be Hashimoto's thyroid, autoimmune thyroid. Pardon me, because there's a trash truck in front of my house. Hopefully you can't hear it. Autoimmune thyroid. Your immune system is attacking and destroying your thyroid, and hence you'll have what? Inflammation. Rheumatoid arthritis, where your immune system is attacking and destroying joint tissue. Inflammation. Your immune system creates inflammation. And again, smartly, your body will send out cholesterol to go put the flames out, the inflammation out in your body. So what do we see when we do blood work? We see that cholesterol is elevated with people that have autoimmune disease. So would it be a good idea to shut down the response to inflammation? Probably not. This is what I like to say. If you fell down and scraped your knee, the next day what's going to form on your knee is going to be a what? A scab. Well, the internal scab for the inside of your body would be cholesterol. You see in the picture to the right here, we've got an artery and you looked at the inner skin lining of your arteries, it's called endothelium. So we have a healthy artery on the left side and we have an unhealthy artery on the right. So the right side, what forms? Your body sends out cholesterol to go heal up that tissue. Wouldn't it be a good idea to stop the process, the damage in the first place, so that your body doesn't have to send out cholesterol to heal that tissue? I think that's a much smarter thing to do. So let's talk about solutions. The first thing, your doctor will send you statin drugs. He will put you on a statin drug. Statin drug is a cholesterol lowering drug. Many people are on it. It's so popular. It is actually the #1 best-selling drug ever, statin drugs. But we want to talk about some problems with statin drugs. First and foremost, people can develop a condition called rhabdomyolysis, which means overt muscle tissue damage and creates tremendous joint pain and muscle pain sort of all over your body. Well, another side effect is liver failure. That's not a good thing. On the left side there, you see this little book. It's called Lipitor, the Thief of Memory. This book basically states and shows and demonstrates in the science that taking and being on a statin drug can actually cause brain fog, but actually you can lose your memory with taking statin drugs because your brain is over 60% fat. So deplete your brain of fat, and guess what? Your brain's not going to work so well. The bottom corner says drugs known to lower, men, pay attention to this, drugs known to lower testosterone levels. At the bottom left side, statin drugs. So men, testosterone, forget about it. So the picture there, the #1 cause, I want to emphasize this. That's why I'm talking about it at least twice, maybe more than that. At the top above my head there, we have what? Potatoes, we have corn, we have pasta, we have honey. Oh, honey's natural, and fruit, it's natural sugar. That doesn't matter. No, it does matter. Doesn't matter if it's fruit sugar or honey, it still raises your blood sugar, which raises your insulin and cortisol, and the damage begins. So starch and sugar, the problem. The FDA food pyramid on the right side, the base of it is starch and sugar. Gee, it must be why that 1 out of every 3 people has prediabetes or prediabetics. And why is the #1 killer still heart disease in this country? Because we eat way too much starch and sugar. So sugar intake then and now. Back in the day, 200 years ago, the average American ate 2 pounds of sugar a year. You'd say, well, that's a lot. Well, compared to today we eat 152 pounds of sugar in a year. Could that be a problem? I would think so. So sugar raises your insulin. Insulin is a fat storing hormone. This is why we will store fat on the outside of our bodies. But when we raise our sugar, insulin goes up, we raise cortisol, and that is going to cause us to raise our cholesterol levels. Prediabetes and diabetes as the cause of heart disease, yes, because 1 out of 3 are pre-diabetic, and diabetes is a big problem today. I would suggest that blood sugar problems probably now would be a pandemic. This is the diet that you actually should look at as far as a solution. We need to look at the ketogenic diet. It's the most biochemically correct diet that we can do. And notice it's completely the FDA pyramid upside down. What's the base of it? Fats. Eating fat never made you fat or raises cholesterol. It's always been starch and sugar. So good fats, such as grass-fed butter, coconut oil, lard even is good, avocado, wonderful stuff. Protein is the next level, and at the top, carbohydrates. You want to have the least carbohydrates in your diet as you can. Probably the perfect thought is eating proteins, vegetables, and good fats. If you could do that, you will have an amazing cardiovascular, healthy life. Things will go well with you. Nutrients. What supplements could you take? Something, if you look behind my head, this is called CHOLAPLEX. CHOLAPLEX is a multi-nutrient supplement that's phenomenal because what it does is it helps to support your liver, but also normalize your cholesterol levels. The product to that right side over there is called AF-BETAFOOD. It's made from beets, beet leaf juice, and seed. And what it works on is the front end of your liver, which is your gallbladder, which will help improve your cholesterol levels. So in summary, starch and sugar, bad, raises cholesterol. Autoimmune disease, inflammation, raises cholesterol. I would suggest before you damage your heart and cardiovascular tissue that you switch your diet around so that you are not causing damage to your heart and blood vessels. You can lower your cholesterol with some of these things that we suggested.